Hello and welcome to the next interview for the Passion and Possibilities interview series. I'm Charlotte Canny, supporting women to feel confident in birth, and today I'm really happy to welcome Linda from Bumps to Babies in Sutton Coldfield. And Linda is a woman who wears many hats, very passionate and talented woman. She is a midwife, she is also a hypnobirthing teacher and a massage therapist, and that's just a few for starters. So welcome, Linda.
Thank you very much, Charlotte. Thank you for asking me along.
Yeah, it's really great to have you. I wonder if you could just introduce yourself just a little bit and tell us a little bit about how you became passionate at birth and do what you do.
Sure. I've been a midwife and nurse for quite a long time now, probably about 30 years, and I've really seen the profession change over that time. And I've gone from sort of quite a sort of young, newly qualified midwife into, I guess, what you'd probably classify as a senior experienced midwife now. And I have seen the whole profession change as well. And so it's really sort of piqued my interest, because what I'm noticing is that the NHS generally has become quite risk averse. And so a lot of sort of policies and guidelines are set up to manage sort of worst case scenarios. And in the middle of that, for me, are a newly pregnant couple who have just no idea how to navigate sort of roadmap through to birth. And often I think get chivied along into all sorts of sort of processes and procedures that when they look back on the birth, they say, you know, I wish I'd have known more about this because it really would have helped my decision making, and perhaps things could have been different. So I think the way that I've evolved as a midwife, I am an empath by nature. I really do feel deeply when women, you know, talk to me about their birth experience. And I always do try to sort of focus on positivity, but where people have had a birth experience that slightly deviated from what they'd envisioned it being, and when I sort of debrief it with them, I often sort of think, oh gosh, I feel quite upset for them that I hadn't been able to sort of impact on this couple at the point of, you know, at the stage of their pregnancy where I could have done that, simply to almost mitigate what I know can sometimes happen if you don't have some control of the process. And I hope that sort of makes sense, because I'm really, really keen on this business of birth planning and sort of almost producing a proposal rather than a plan. And this is something I've been working on for the last sort of 10, 11 years in my birth classes, is to get people together and say, do you know something? If you know everything there is to know about the process, everything, okay, focus on normality. But what about if this happens or that happens? I think truly, I know it's a bit cliche, but you know, knowledge is power, isn't it? Truly. And for me, if the couple are aware of all the different little roadblocks and stumbling points along the way, and yet they understand the process and they can question and keep themselves at the centre of the decision making, I truly believe that that gives a better birth experience, whatever the mode of delivery. So that's the sort of work that I've been doing in this time, because, and genuinely, Charlotte, I think that the profession is becoming very medicalised. I do fear for the UK midwives sometimes that it's becoming more like the American model, where midwives are becoming more like nurses, and that doctors are getting far too much, you know, involvement in what is a normal process. And for me, it's empowering the ladies that come through from Bumps to Babies to say, now, look, should you be engaged in this type of discussion, this is how I would like you to actually respond. Yeah. Those of me that, you know, those people that follow me on social media, etc., that sort of phrase, you know, you make more decisions sometimes buying a kitchen than you do asking about the birth of your baby. And I'm trying to sort of reverse that. Yeah.
Yeah, that's really wonderful. I think that's really great. A roadmap and empowering women to question and be informed. And I'm sorry that that is the state that we have to do that, rather than just going with the flow, because the flow ends up being the system's flow and not your flow, when it, as you said, it's a normal process. And process with so much fear that's grown up around it. And I love that you're there as a midwife empowering women in that specific way. It's really great to to have people like you there.
Thank you.
And it makes such a difference, doesn't it? The transformation that you can see from the beginning of someone's journey, and to feel they have that knowledge, to feel that strength then to make a difference whatever happens.
I love it. And I've got so many stories up my sleeve in the last couple of months of people who have rung me, you know, at the 40-week appointment and said, Linda, the midwife said to me, do you want to pop on the couch and I'll do a sweep? And I said to them, no, thank you. I'm not really feeling that today. And I said, yes, well done. Well done. Why should you interfere? You know, so that's another big thing we're looking at. You know, your body births your baby when it's ready. And so I love it when women feel they have the confidence to actually push back rather than being carried along on the system.
Yeah. That is something I'm very passionate about as well, having that confidence. So there's knowledge to know what is possible, what's allowed, what's good, and then the confidence to say what you want in the face of an authority that's saying we'd like you to do this, when it may be just a suggestion, but we're so conditioned as women to go along with those suggestions, doctor knows best, and just to do it thinking that that's best, when it may be just a suggestion, we'd like you to go on the couch, but who is that benefiting? Who, you know, who's it for? And you can say maybe you want to, and you can go, yeah, I'd love to get on the couch, but I'm going to do it this way in this position, or maybe you just don't do it. I want to do this, I want to do that. And it's wonderful that what I find when you have that in you, like you're saying, when you're supporting people to feel confident to do it, the whole atmosphere of the conversation changes.
Yes.
And how you're listened and heard. It's wonderful.
Yeah, it is. So, yeah, I'm very much aligned with what you're saying there. And that has become my ethos now. I mean, I'm in the sort of later period of my career now, but this is what I want to do. And when I'm working in local delivery suite units, etc., talking with young midwives, etc., and yeah, they do sort of say, Linda, you've got so much sort of kindness and empathy with the women. And I say that's come from lots of experience of, because some of the things that really distress me, you know, are women that when I walk into a room, they're feeling overwhelmed and they're very vocal and they're thrashing around all over the place. And all it needs is somebody to sort of come in and to help them to breathe, to find their space, to see what's going on, to see what's on their mind. And that's transformational.
Yeah.
You know, I know that I can do that. And I don't think women should have to be in a position where they're feeling slightly, you know, overwhelmed by the situation.
Yeah, that's really important, bringing it back to the women.
Yeah, it is. Yeah.
It's amazing what a difference it can make when you are heard and respected in that way, listened to,
yes,
believed, and it's
powerful.
It's so amazing, because that can change the whole, whatever's happening, it can change everything. And
yes.
the natural strength, like you said, it's a normal process. The natural strength can come back within whatever's happening in that way. One thing I would like to, we both do massage. I'd love to talk a little bit about that, because that can be part of a transformational journey during the pregnancy, before the birth, where when you're seeing people in that way. So tell us a little bit about that, what you do and how massage can benefit pregnant women.
Sure. I've been massaging now for probably 5 years, Charlotte. I absolutely love it. I just love it. I think it gives me a very, very special connection with the women, and helps me to do sort of the hypnobirth training as well. So what does it do? It gives so many benefits. I mean, you know as a massage therapist yourself that, first of all, in terms of any aches and pains, you know, if, for example, you bang your arm, you rub it, don't you, and that sort of thing. It's based on that, isn't it? So to start off with, hands-on, I think there's something beautiful about that. Aches and pains, all the usual aches and pains, but the commonest ones that I get are things around the pelvis, so pelvic girdle pain, piriformis pain, which is buttock pain, and hip pain. Those are the big things. Occasionally get upper back pain, swelling in the lower legs, swelling in the fingers, all of those sort of things. So we do a sort of type of massage which is based on sort of helping to sort of disperse the fluid. So that's the first thing. I can do some soft tissue release techniques, and I use a special instrument as well. And this is really, really good around the neck if that's hurting. So we do some special strokes with this instrument. And then I've been trained to get the ladies into certain positions where I can release the piriformis. So I can actually get them onto their side and do special releases and give them exercises. So it helps with circulation, it helps with aches and pains, it helps with their endorphin release, it helps with relaxation. It's another reason people come to see me, because they're all tense, maybe still at work, trying to juggle their life, demanding jobs, driving all around the country. So it gives us a chance not only to do some hands-on, but to chat, see how the pregnancy's going, talk about any concerns they have, and we play a hypnobirthing tape. And it's lovely, actually. And they go out. I love your word, transformed. They go out floating on a cloud, and I love that.
Yeah. It is very true. And just your presence, like mine, with being confident about birth and having that energy about you, is catching in itself. So when you help them into a very relaxed state where the brainwaves are different, they're learning something without the words, without this textbook thing, but that embodying, they're returning to themselves and that knowledge that's innate, that's in them about birthing, that can really support with that way when you have that kind of support. And my massage is slightly different, but very similar. Probably some of the similarity techniques. I work a lot with the energy and the imprinting and releasing and that kind of thing, but just the presence is really beautiful. And you do something else that I don't do that I think is something that I'd love to speak about, because many people don't know that it's possible or needed, and that's with when there's been so many cesarean sections and people going for a second birth are often very motivated to do it differently. And the scar, you do some massage around the scar, don't you? Would you tell us a little bit about that?
I do, Charlotte, and this is becoming more and more prevalent, because the C-section rate in the UK is now outrageous. And this is something you and I have discussed, inductions and all the rest of it. So I am seeing more requests for this. Now, it's only come into my consciousness in the last couple of years that massaging a C-section scar, it was a thing. Because as a midwife, I used to just look at the external wound and say to the ladies, 6 weeks, looking fabulous, everything's good, do your pelvic floor. And this is when I was working as an NHS midwife. Now I'm looking deeper into how I can help and serve women. I know, for example, that the wound itself, to actually help to birth the baby, there are 3 incisions. But in terms of the healing, it heals in 7 different stages and can take up to 2 years to heal. So even beyond the external healing, we need to be mindful of what's going on underneath that scar. And what's going on, and this is what I describe to ladies when they come round, is adhesions. And I sort of describe this as being very much like the Spider-Man web that he shoots out of his wrist. Shooting that all over your pelvis, some upwards towards the bowel, some outwards towards the hips, some downwards towards the bladder. Now we have a fantastic opportunity to try and release those adhesions, or in fact prevent them even laying down. And how do we do that? Well, from about 6 weeks, I start to massage the scar. And it's quite a specific technique that we teach the ladies how to do it, but just gentle movements of backwards and forwards, rolling round and round, side to side. But we actually massage above the scar, underneath in the deep muscle, on it and below it, and then teach the woman how to do it. Give her a load of stuff about C-section recovery, because there's diet involved and exercising not to do. And we also advise, for example, there are a small percentage of ladies where their wound heals into more of a raised scar called a keloid scar. So we give them some examples of what they can put onto it. There's brilliant silicone products out there if they want to use that help to flatten it. And you really need to be doing this, 1 to twice a week in the early months, and up to 2 years, probably checking in every now and again. What you're looking for, in fact, is as you're moving the scar, does anything feel stuck? And if it does, we give them techniques to sort of rock it till it melts under your fingers like butter. So it's great. It's a really good, really popular massage.
Sounds like it would benefit not just if you're having another birth, but in general for your fluidity, flexibility in life.
Yeah.
In general, with keeping active and
yes, and actually just building quickly on that point, because why do we do it? Well, it's not just adhesions. If you've got a scar that becomes stuck because nobody's taught you how to move it, later in life, post 40, we tend to find that women, when they're turning over in bed, feel like something is restricting them. And also these adhesions can almost attach to the bladder, so the lady feels like she's permanently wanting to have a wee. So it has implications for later on, and that's why we like to nip it in the bud. And it's never too late to start.
I was going to check that. It's never too late to start, but easier in the beginning. Is that right? As they're still laying down.
Yeah.
Really wonderful. I'm hoping that, you know, more women know that's possible, and in the long term, I'm hoping less women need it.
Same here. Same here.
And then we can just have other massage. And one of the things I wanted to ask, I often get women that come to me very late on. It may be different for you as a midwife, but very late on, and they just want to treat themselves. And I love that, and I do that, and I always think it would be so wonderful if you come earlier and regularly, not just to treat as if, oh, just to treat. Just, we've done so much hard work and we're just going to treat ourselves just this little bit, when actually you're building a whole baby, growing a whole baby, and this is the most important thing you can do. And you, the woman at the centre of that, matters so much in that. And just, you know, like you said about the kitchen earlier, how much time you spend choosing the kitchen, how much money you spend on the kitchen, and you use it every day, so that's great. I'm not criticizing the kitchen. I'm saying that the preparation of you and looking after your body that's growing the baby, and how much energy that takes, to come more often and regularly. And it's a financial investment perhaps, but if you can, or finding ways to do that, or to learn to do it, and doing it with your partner or your friends, if you know, just to really bring it into your life. So I was wondering if that's something you notice or feel as well.
Oh, absolutely. You've hit on something so important there, Charlotte. I'm seeing this an awful lot lately with women who are focused on their career. And the sort of mentality that I'm seeing is, I'm just going to wait till I've gone on my maternity leave. I'm going to get everything sorted then. I'm going to get everything sorted then. And particularly with hypnobirthing, because we should ideally be starting that, my belief is, pre-24 weeks. You know, take your sort of training all the way through the pregnancy if you can, because it helps you to cope with all sorts of anxiety and fears, and brings you to a place of calm. And I've got examples where I've sort of done the training with the couples, given them all the tools, everything, see them a little bit down the line, or I haven't read the book yet, I haven't done any of the scripts yet, I haven't done any of this yet, almost as if just that time with me has miraculously given them the ability to hypnobirth. And lo and behold, recently 2 of them have given up work, and 2 days later, the baby came. Do you know what I mean? And this thing about, I'm going to leave it till, you sometimes don't get the privilege of that time. So I think you've just got to put this a little bit more central to your life. And it does take the period of mental adjustment, doesn't it? You've just been the 2 of you, and you've just been work orientated, and it is an adjustment to think about, you know, your baby and your body, but don't leave it too late. Give yourself that time to get really prepared.
Yeah, definitely agree with that. And I think it's a symptom of a larger thing where the women, and particularly as mothers, we're conditioned to put ourselves last. So the career, and you're focused on that, and you're focused on these things that have been given an external value in some way. And then it's like you said, putting it, well, we're compartmentalizing, here's the career, and we're really focused on that, and that's been valued and important to you. And then at the end, well, now we can focus on that, and there's no time left. And whereas integrating it in a more balanced way, and it's a real paradigm shift, putting you at the center of your career as well, in your life, your balance, and the baby birth. And so different to like hypnobirthing, massage, it's all cumulative, the benefits. And we're talking about it in pregnancy, but it's looking after yourself all through life. It's just that pregnancy, you really need it when the body's doing so much more. And the benefit of your baby, who's also enjoying your relaxed state, and what you're teaching your baby about how to live when you're making these life choices.
Yes, spot on. Yeah.
That's really, really, I love your passion, and I love the message of taking your time early and integrating into your life. So What do you find most awe-inspiring about women and birth in general when they're...
Oh gosh, that's a really lovely question. I mean, I was at a water birth with one of my clients about 2 weeks ago, and quite simply, Charlotte, it almost moved me to tears, even after all this time. Just how calm and how relaxed, and literally, baby was birthed, and there was I'm not sort of saying, you know, everybody should aim for this, but there was complete silence. We actually, the first I knew about it was that the baby cried. That to me was awe-inspiring. You know, a woman that I'd met maybe at 16 weeks pregnant, it took her through the whole journey. When I first saw her, she said she was going to have a cesarean booked because she was so scared. We worked together. She had her baby 42 weeks, and she was an older mom. She was about 39, so you know, a lot of pressure on her about induction, but she said no. There she was in the pool, and what inspired me about that, and I was in awe of, was just the power of that woman when it really mattered, to completely close off in this pool and just to gently birth her baby by breathing. It was just, I don't think I can put it into words. It was just beautiful.
That's a really lovely story. I
Yeah.
hope it does that, and I hope it reaches some people even listening here. That's really beautiful. And what breaks your heart about what women go through currently becoming a mother?
Yeah, I think the biggest thing for me at the moment is the amount of unnecessary interference, and it does break my heart. I can't find any other words for it. That, you know, they're sailing along, focusing on normality, having a really happy time, and suddenly they're faced with something that they hadn't even thought about, and to be slightly coerced into it in some situations, and then going through the process, being away from their partner in some units, because partners can't stay with ladies having inductions in certain areas of the country, and then being exhausted by the process, and then the induction not working and having a cesarean. This to me is one of the biggest things that upsets me at the moment, and it's why I'm on this mission to educate women, to say stop, ask for the stats, get the facts, step away, have a chat, find some more information, go back to the care provider and chat again. You know, don't go out that office having said yes and then thinking, what have I done? I think that's important. Yeah, so yeah.
Really great. Well, I hope those words will inspire some women to take a step back and look at something, and choose that step of going for what they want. Yeah. And so I know we could talk for a long time. So much passionate things to talk about, but for today at least, what would you love every woman to know? If there's just one thing she could really take hold of and put into her life, what would you love her to know?
I'd love her to know that if you can really, really get your mind in the right place, then the things that happen to your body are much, much easier. So it's this mind-body continuum. And I believe this fervently, you know, that where a woman is able to focus on her breathing, focus on her mindset, get herself back into a place of calm, that whatever she's faced with in pregnancy, labour or birth, that seems less uncomfortable, less concerning, and there's evidence to show this. And when I did my hypnobirthing, I was told there was evidence, but now I've seen it for myself. I really believe that if you can keep your adrenaline low, your oxytocin high, the whole experience is so much better.
Wonderful. Yes, that was certainly my experience with my births as well, and I do love to see all that and hear it from someone who's been at a lot more births than mine. I've been at my own.
I've been at about 700, I think. That makes me
Yeah.
sound very...
I'm on 4 if you count my 3 children and my own birth. And the contrast between my own birth and my children, I mean, the challenges in my own birth were what led me to do it differently with my children, with coming back to that self-belief inside. That was my journey. The belief of it could be different, not traumatic, not interfered with. And that was what I achieved with all 3 of my children. And again, like you said, taking the time early on, right on cue. He can come in if he wants, as my son coming in. Taking that time to prepare. You can go, just let him come in. Taking the time to prepare and making that difference like that has been the most beautiful thing. So yeah, so thank you so much for coming on today, Linda. And as always, life always happens when you're a mum. And you can't separate everything out. You have to keep going and work out. And here we have my husband going to work, my child coming in, and a wonderful interview with you. So I know you've got a lot to go on to do. So I've so enjoyed chatting to you.
And I have with you, Charlotte. Thank you.
I look forward to speaking again. We could have more conversations, and I hope that it's really beneficial for any of the women listening out there today. So thank you so much.
Thank you, Charlotte. Bye-bye.
Bye.